Australian Dental Association, in 2009, for every 100,000 Australians, there were an average of 47.4 practicing dentists. A breakdown of this figure showed that major cities had an average of 59.5 dentists per 100,000, while remote or very remote areas had as low as 17.9 dental professionals per 100,000 population. Now to highlight this issue, a video on a remote community close to home.
Yarrabah, a former Aboriginal mission settlement, is a community governed by Aboriginal Council 15 kilometres east of Cairns at Cape Grafton. Yarrabah is an Aboriginal word meaning meeting place. The two main tribes that live in Yarrabah are the Gidunji or Gunjai tribe and the Yidinji tribe. The main indigenous language spoken is Yidinji. The Yarrabah coastline runs east from False Cape around Mission Bay, past Cape Grafton and Kings Point, and then south to Palmer Point. The total coastline is in excess of 60 kilometres. It has an area of about 154 square kilometres. The township of Yarrabah is for the most part located adjacent to Mission Bay. Yarrabah was originally a mission of the Anglican Church. However, in 1985, the Department of Aboriginal and Islander Affairs handed the deeds to Yarrabah land back to the people. Yarrabah is now referred to as a Deed of Grant and Trust Community, DOGIT, being self-managed by the Yarrabah Aboriginal Shire Council. How you going? My name's Caleb Petrie, reporting from Yarrabah. Basically, I'm just going to be talking a little bit about the demographics of Yarrabah today. So basically, the area has a population of around 2,600 people, according to the 2008 Bureau of Statistics. However, the official estimates of the population is probably a bit undercounted due to both language barriers and the transient nature of the residents of the outstations. So at the 2006 census, Yarrabah and its outstations recorded a population of 2,371. Of those, 96.9% identified as Aboriginal or Torres Strait Islander. The median age of Yarrabah residents was 21, compared with 34 for the Cairns Statistical District. Based on the Australian Standard Geographical Classification, Remotedness Area, the ASGCRA, Yarrabah is considered a RA3 Outer Regional Area, which is the same classification as Cairns. So Yarrabah has some basic services on offer. Basically, with respect to health, Yarrabah's health services are consolidated under the one roof, incorporating the Queensland Ambulance Service, Garrini Yallamaka Health Service, Aboriginal Corporation and Queensland Health. The services available include, basically the ones they have in Yarrabah, they have regular general practice type clinics, they have emergency care 24 hours 7 days a week, they have children health, women's health which incorporates antenatal and postnatal care, a well women's clinic, a chronic disease management clinic and basic radiographer services. The visiting services include general physician, which is monthly, obstetrics and gynecology clinic, which is every 6 weeks, an outreach mobile women's health nurse clinic, which is monthly, diabetic outreach team quarterly, ENT quarterly, Australian hearing services quarterly, as well as dental. Right, so I'm back at Yarrabah here. So basically we're going to be talking a little bit about employment. So the majority of Yarrabah's workforce was engaged as either labourers or as community and personal service workers and worked in local government administration or social assistance services. The median individual income was $224 per week, compared with $534 per week for the Cairns Statistical District. So with regards to education, basically the Yarrabah community has a state preschool. It also has a primary school and high school, which extends to year 10 only. The nearest school for students continuing to senior years, so years 11 and 12, is located in Gordonvale. With transport, Yarrabah is serviced by the Paradise Bus, which is based in Babinda. The bus service provides travel between Yarrabah, Edmonton and Gordon Vale and Cairns. So Yarrabah has some other services available. Basically these include a police service and Yarrabah Community Police. They have Centrelink, they also have a library and a training centre. They have a women's shelter as well as a museum. They also have a community centre, which is a police citizens youth centre. They have the Lloyd Formal Aquatic Centre, the Yarrabah Aboriginal Council Administration Centre, a rehabilitation centre, and also they have an age hostel. For most other commercial needs, people need to travel to Gordon Vale or Edmonton. The road to the community is bitumen sealed and is accessible all year round despite weather conditions.
To alleviate the discrepancy in healthcare, there has been a movement towards increasing the number of Commonwealth-supported positions at universities, ensuring dental courses are financially accessible for qualified applicants from all backgrounds, as well as offering rural and remote scholarships. Furthermore, since 2005, a university in far north Queensland has started accepting students into a dental course with a focus on delivering care to remote and Indigenous communities. The course was forged with the expectation that at least some of the graduates will practice in currently underserved regions of Australia. This model of rural training has certainly been successful for medicine. The students are required to complete a year of professional placement in remote communities, and this will hopefully encourage the new graduates to pursue a career in rural Australia. One of the main determinants for intent to work outside metropolitan areas is rural origins. Accepting and accommodating qualified applicants who are from these areas may potentiate return once registered as a practicing dentist. As a more downstream approach to recruiting dental professionals for rural practice, the Dental Relocation and Infrastructure Support Scheme was created to strengthen services in the bush. Beginning in 2013, the program aims to provide incentive to dental professionals by offering financial reimbursement when relocating to a remote community from their current location. Depending on how remote the dentist is willing to go, payments between $15,000 and $120,000 are available. As an adjunct to this, there is also up to $250,000 in infrastructure support supplied to aid in establishing a practice once relocated. Yarrabah, being an outer regional region, would offer $15,000 for relocating from inner-regional areas and $30,000 for those moving from major cities.
Hi sir, thanks for the lecture. Do you have a minute?
Sure thing.
I'm from a small town myself and I've always considered practicing in a remote community. I just have a few concerns and wanted to ask you about it.
Of course. How can I help?
After watching the video on Yarrabah, I'm just concerned about the small team of dental professionals. Working in a community such as Yarrabah, the number of dental professionals is limited, and in some cases there may be a sole dentist working in the community. This in turn may lead to a higher workload, stressful work and longer hours due to the limited staff and sometimes long waiting lists. Similarly, in these communities there's insufficient supervision, especially for newly graduated dentists like myself, who are likely to be the ones that work in these areas. Being one of only one or a few dental professionals in the community may require the dentist to be on call on top of their usual working hours. Lack of specialists such as oral surgeons, periodontists, endodontists may result in the clinician undertaking procedures which are out of their expertise.
That is a very real concern, Sian. There are several services, such as telehealth, which can put you in contact with other dental professionals where you can get advice on treatment plans or even be stepped through some of the complex dental procedures. It's also really helpful to have specialist contacts to consult with if necessary.
Okay, great, thank you. I'm also concerned about the lack of resources in communities such as Yarrabah. Small dental clinics in rural and remote communities may only have basic dental equipment, which may limit the treatment options for the patients. For example, the clinic may not hold endodontic instruments, leaving the only treatment option for a particular tooth as extraction.
That is an issue in a lot of rural and remote communities. It is obviously ideal to have the latest technology in the dental clinic, but it is an important skill to be able to work with the resources that you have available. For example, you might be required to process X-ray films by hand rather than using a digital system.
I guess it'd be a huge learning curve, but that's to be expected at any clinic I'll work at in the future. In regards to social isolation, which I've heard can be an issue in moving to a rural town, I'm worried that in a town with a population of only 2,600 people, that dental professionals may feel isolated. There also may be lack of social and cultural facilities, for example, places of worship, sporting clubs, etc., in the town which may make the dentist feel socially and culturally isolated. And this is a huge issue in regards to recruitment of dentists in the areas such as Yarrabah.
You could always try and arrange some meet and greets, try and be a part of the community. It may take some time, but you can learn a lot about the local culture, new skills, or just enjoy living close to the beach. And where some degree of social isolation is expected with rural placement, but the rewards and experience as a professional can be endless.
What about opportunities for professional development? As well as having a small dental team, there may be little room for development and learning new skills in a small community due to the lack of resources. For example, there is limited access to CPD seminars, which are only available in metropolitan areas. There may not be opportunities for promotion and growth as a professional.
If you're looking at moving to Yarrabah when you graduate, remember that it's less than an hour drive to Cairns, where there are many opportunities to attend CPD seminars.
Okay, are there any reimbursements for the trips that I would have to make to those lectures? Similarly, although it would be ideal to have a permanent dentist in Yarrabah, which is not currently in place, a high cost of living may make it difficult for dental professionals to relocate to a small community such as Yarrabah. Similarly, commuting from Cairns to Yarrabah would present significant travel costs. Also, in regards to finances, there are also significant financial burdens to starting up and maintaining a permanent dental clinic in a community such as Yarrabah. For example, a dentist needs to have approximately 3,000 patients to be financially stable, as reported by the ADA. This could also be an issue in a small community that has a population of less than this. Can you suggest any strategies to overcome these issues?
Well, there is roughly a population of 2,600 in Yarrabah, maybe even more. Plus the support scheme I mentioned in the lecture would provide some financial aid. So I imagine those two coupled together could meet this average you mentioned to make you financially stable. And with the commute for CPD lectures to Cairns, you could claim those on your taxes as a business expense, as you're forwarding your career by doing so. Does that answer all your questions?
Yes, it does. Thank you so much for your time.
So Sian, what brings you here today?
I've been living and working in Yarrabah for a year or so now, but I'm having a few issues both at work and with my social life.
Okay, so what are some of these issues?
Well, firstly, on a more personal level, I'm finding it really difficult to fit into this community because it's so different from where I've lived previously.
Well, when arriving in a new community, there are 4 stages of adaptation faced by health professionals like yourself. Firstly, there's the honeymoon phase, rejection phase, resolution phase, and lastly, acceptance phase. So you'll first experience the honeymoon phase, where you're excited and enthusiastic to explore the new community and their cultures. The next phase is the key issue regarding retention of health workers like yourself in rural and remote areas. You can experience cultural shock and consequently undergo stress, depression, anxiety, or discomfort whilst trying to understand unfamiliar cultures and sometimes language barriers as well. This cultural shock has been linked to high employment turnover rates in rural and remote areas, as many practitioners like yourself don't overcome this phase. If you do manage to overcome this phase, you will adjust and cope with the new culture and accept the community's way of living.
So what can I do to overcome the culture shock and feel more comfortable here?
So some ways to overcome this cultural shock include: firstly, I want to encourage you to have positive social interactions with the local residents and to involve yourself in community activities outside your workplace. University curriculum should have included education on providing culturally safe health services in rural areas. But if you didn't receive this, maybe there are some courses you can take to better your understanding. It is also helpful to try and gain support from community leaders such as elders, council members, or established health professionals, which may ease your transition into the community.
Okay, thanks. I'll try some of your suggestions. I'm also feeling that because I'm practicing in a rural and remote community, I have less opportunities to advance in my career and increase my knowledge, as opposed to if I was working in a metropolitan area. Do you have any ideas on how I could grow as a person and as a professional, or how to advance in my career without having to relocate?
Well, you should also speak to your employer about your concerns, as I'm sure they will also have some suggestions for you. But on a personal level, I do have a couple of ideas. You may like to try incorporating reflective practices to ensure that you develop greater understanding of yourself, cultural situations you face, and difficult cases you may encounter. This can assist you in gaining knowledge from your past experiences and develop lifelong learning, which may help you grow personally and professionally. By being more actively involved in the community, it may also allow practitioners like yourself to voluntarily give back your knowledge, expertise, and time to the residents. You might do this through representing the community in nearby remote outreach programs, through council meetings, or through rural health clubs. And I'm sure you'll find yourself growing as a person and as a professional if you are more actively involved.
I haven't thought about those before. I'll give them a go. The last thing I thought you might be able to help me with is that I'm feeling really snowed under at work and always stressed out and never really get any time to myself.
This is a very common feeling for health professionals working in rural and remote areas, and becoming overloaded and overwhelmed with work does impede on your mental well-being and health. It is important that you maintain a healthy balance between work and personal life to reduce stresses, improve job satisfaction, and hopefully want to stay in rural areas. Again, you should bring this up with your employer, but personally, you should ensure your patients and other community members in general are aware that you are a sole healthcare provider and you cannot be on call 24/7.
Well, thanks for your help. I'll talk to my employer next time I see him and see how he can help me.
Hi Sian, I heard you're having issues regarding the isolated feel of professional workplace.
Yes, actually, it does feel quite isolated here compared to a metropolitan practice. Is there anything I can do to gain more support in my workplace?
Okay. Well, the provision of professional support and ensuring a safe and appropriately equipped working environment may help to minimise the isolation and increase retention of health workers in rural areas. Some strategies we can implement to improve the support you receive include things like using a telehealth communication system like we are today, more often to give you support from specialists and also interdisciplinary health workers. We can also improve workplace conditions by providing adequate and appropriate equipment, supplies, and technology, if you think it's necessary. We can also give you appropriate mentoring, networking, and communication between health staff to make sure you feel comfortable in the workplace.
Does a long-term commitment to a rural or remote healthcare offer less opportunities to advance in my career and knowledge as opposed to working in a metropolitan area?
Actually, it doesn't. So, in fact, this is a common misconception amongst practitioners working in these areas. Both personal and professional growth can be achieved whilst practicing in rural and remote regions, which may help increase retention for healthcare workers. We can do this by making sure you get recognition for long-term commitment to rural and remote health at the local, national, and international levels, such as things like awards, titles, and grants, which can be an incentive for you to remain in areas like Yarrabah. We can also provide senior positions in the workplace so practitioners like yourself can advance in their careers.
I see. One last thing. I'm finding it difficult to maintain that healthy balance between work and personal life. Sometimes I feel overwhelmed with the workload, and I feel that this affects me both physically and mentally.
I understand your concern. So, usually this is actually an issue that can get out of hand. However, there are strategies that we can implement to help you maintain this balance, which would hopefully reduce stress, improve job satisfaction, and encourage you to stay in rural areas. What we can do for you is make your hours much more flexible, and we can negotiate working hours which suit you. If you feel it would be beneficial, we could also consider recruiting another practitioner into your workplace to help spread the workload. Additionally, we will ensure that you get a sufficient amount of annual vacation leave, especially on the Christmas holidays. Does this sound okay?
Thank you so much for your help. I'll take those few points and work on them, and I'll contact you if I need any more help. Thank you.